Hello everyone, my name is Nitin Grover and following is the presentation on my research capstone. So the title of this research is Schizophrenic Subjects Identification with Deep Learning and EEG Connectivity Features. With this research and the work done under the capstone, we aim at creating an efficient and reliable diagnostic system for schizophrenia, which is supposed to be better than the ones already existing. Moreover, with this research, we also aim to improve our understanding of a schizophrenic brain, which could help us improve the life experience of the patient suffering from schizophrenia. So talking about the background of this research, what exactly is schizophrenia? It is a serious mental disorder that impacts a person's ability to think, feel and behave clearly. The standard experiences usually include hallucinations, like hearing voices or seeing things that are not actually there, paranoia, delusions, or disorganized thinking. The symptoms could involve depression, lack of sleep, social anxiety, irritability, etc., which are also symptoms that could happen due to many other reasons, and they're not a necessarily sign of schizophrenia, so the diagnosis can be difficult. There are no exact causes of schizophrenia that are known to us. It could be hereditary or it could involve other environmental factors during birth. But according to WHO, schizophrenia is treatable, but its treatment could involve long-term medication. While many treatments are useful, they are also limited and palliative. So what is EEG? Our brain is made up of a network of small cells called neurons, and those neurons communicate with each other using electrochemical signals that enables us to think, feel, and interact with the environment. As these electrical charges are responsible for brain activity, we can listen to these communication signals and gain many insights into our brain's functioning. This forms the basis of electrophysiology. We can do this by using small electrodes, by placing those electrodes on the head, as shown in the picture. So this forms one of the most fundamental diagnostic tools that can be used by a neurologist. Talking about connectivity features. In graph theory, the brain is modeled as a network consisting of nodes that represent the different areas of the brain, or it could also represent EEG channels with like directed or undirected edges between them that represent the functional connectivity between those respective nodes. So on the right side, we have shown a standard 1020 EEG montage with 19 EEG channels that are particularly used in this research project. So what we do here is we receive signals from different areas of brain and try to find a pattern between them. Like, are the both signals rising and falling together? Like if they have a phase relationship, or we can also say like if they are synchronized to each other. Or it is also possible that we find a causality relationship between two signals. Through causality relationship, we can monitor the direction of flow of information from one area of the brain to other. That could give us many insights to the brain's functioning. So the basic flowchart of this project resembles a common machine learning pipeline. We start with the EEG data acquisition, then pre-processing phase, then the feature extraction phase, then the last phase is classification. So on the right side we have more illustrative example of the same. So we here after the features are usually extracted in the form of matrices. Here we have a 19 cross 19 matrices where 19 represents the number of EEG channels. In this particular matrix, a particular value like I, jth value represents the strength of a particular connectivity measure between ith and jth channel. So we have a full matrix, and that can be use those matrices as an input to our neural networks for classified. So in here we have shown group differences for each connectivity measure. These are illustrated in the form of graphs. So only the strongest of the connections are shown. So we can draw many inferences from observing these graphs. Like we can observe some increased synchronization in the frontal brain regions in the case of schizophrenia, as depicted by PLU measure. And as depicted by PLI measure, we can observe reduced synchronization on the posterior brain regions in the case of schizophrenia as compared to healthy subjects. So now talking about the DTF, we observe a high information flow from the occipital lobes to the frontal lobes in case of schizophrenic patients. Similar trend follows in the case of PDC also. So these are the causality measures. So they are depicted by an arrow. So they show the direction of information flow. So similar synchronization trend we can observe in the synchronization likelihood. There is increased synchronization in the frontal areas in the case of schizophrenic patients, and also there is a high correlation for schizophrenic patients. We can use these differences to classify them. So in this slide, these are the difference. So this is the difference in average adjacency matrices of the respective connectivity methods, that is again shown in the form of an adjacency matrix. So we name that matrix that we are extracting after the feature extraction phase. We name it as adjacency matrix. So in this image, we have 14 healthy patients and 14 schizophrenic patients. We average all the matrices of healthy patients and of schizophrenic patients, and then take a difference of them, and we can observe. This can provide us with the insights to the degree to which each connectivity method helps us distinguish between the two classes. So in this we can observe the PLV measure has as compared to PLI measure, very high number of differences between the healthy and schizophrenic classes. And again, DTF and PDC and correlation all have very high differences in both the classes comparative to PLI and SL. The same can be observed by looking at the accuracies. So PLI and SL are comparatively the least performing of all other indices. The best performing connectivity measure could be the DTF, that almost gave 99% accuracy for architecture 5. Similarly, PLB and correlation also follow kind of similar trend. So we can relate this to the differences to the